Hi, this is Ellen Madono, and thank you for joining me at my website, tokyohomeopathy.com. Today, we're not going to talk about homeopathy because not everything can be healed with homeopathy. I'm going to introduce how I protect my knees and give my knees therapy while I'm exercising. For me, the whole point is to quickly go back to exercise after I've been injured or my knee hurts or some other part of my body hurts. And since I'm 71 years old, I'm very good at doing this because I've done it many times. I think I could have done it better if I'd known more, but you only learn through living. So I'm trying to share something that might help you, especially my Aikido friends who often need to quit doing Aikido because they hurt themselves, and especially knee injuries and injuries of the hip or back prevent people from doing Aikido, which is a wonderful exercise at any age. So I'd like to show you first the band that I use. It's a rubber band about 1 meter long. It comes in various lengths and widths. It's made of raw rubber, which means that it deteriorates if you don't wash it. Because I'm doing exercise while I'm using the band, it's very important that it is securely fastened to my body and doesn't come off during practice. So I've devised a little holder for my band. It's not so secure that it's difficult to take the band off. I've actually sewed the sleeve of an old sweater, but these days I don't think it's that necessary to protect my knee. So I am thinking of making a thinner holder for it. You'll notice that I'm wearing long underwear. I do this to absorb perspiration when I'm practicing. This is my studio for giving lectures, but anyway, the band is over the top of my knee, and it's about one fist away from the top, so it's in a comfortable place. And the middle of the band is here, so the length of the band is approximately the same on both sides. And I've got it attached to a piece of cloth so that I can easily pull it out and put it in when I wash it. It's just very roughly sewn with hand sewn, and it's the sleeve of a sweater. So the first wrap goes over the top on the thigh, and then it goes under the knee to fasten the bone that's here and the bone that's here to stabilize it. So it puts pressure on that place. But of course, I'm moving a lot, and so I change the pressure constantly as I'm moving, and it's a very vigorous exercise for that area. And so here the two sides come out, come across across the bottom. You might have a different size leg and you need a longer piece of rubber. You have to experiment with this depending on your size. So then I just tuck it in here. But this would never stay if I just left it like this. There's too much activity. So what I do is I take the bottom of my spats and I pull it up and I tuck it in at the top here. Tuck it in. So because it's tucked in, it stays. And actually, it's a very nice support that never comes off when I'm practicing. I'd like to show you that these bands, they're sweaty. They get sweaty, and I don't clean them well enough sometimes. So they get old. I think they would get old even if I took perfect care of them. And they tear, so I knotted this, and I'm just going to use it longer, and it's probably 2 years old. I can probably use it another 6 months, and I'll have to buy another band. So anyway, you can see that this is really a very nice holder. And it's relatively cheap and very fitted to my leg. I can exactly make the pressure exactly right for what feels good for me. And I think everybody is probably different. Okay, so this has been Ellen Madono from Tokyo Homeopathy, and I hope that you can find a way to lengthen your life moving. I think there are many different creative ways, and I hope you will find a way to enjoy your life as long as possible. Thank you.